Hello again, this is Dr. Milescu. I'm doing a series on rehabbing after a hip replacement. Typically this exercise is recommended 2 to 3 weeks after surgery, but it also depends on which incisional approach you had, whether it's anterior, posterior, or lateral. What I'm going to show you is definitely what you can do for an anterior incision. There are no contraindications according to my surgeon other than hyperextension. So you can start extending the hips to neutral doing the next exercise I'm going to show you. In yoga, it's called bridge pose. In Pilates, it's called shoulder bridge. It's also done in gymnastics. There's full wheel, which we're not even going to entertain at this point. For hip replacements, it's all about therapeutic exercise, not about flexibility or hyperextending. So that's definitely out of the question. We never want to do full wheel after a hip replacement. That's never going to happen. You want to keep that hip at neutral, slight hyperextension maybe a year or two after, but never a full wheel. So without further ado, I'm going to show you the different variations of shoulder bridge or bridge pose, and also how to condition and exercise the hip flexors as well as the hip extensor. The strongest hip extensor is your gluteus maximus, your buttocks muscle that you see. So these are important muscles that stabilize our hip implant, so it's extremely important to start to do this right away once you know that your doctor approves exercise. You'll probably get out of the hospital and do some physical therapy at home with your physical therapist. Moving forward, this is definitely an exercise that physical therapists recommend. Also, always a reminder, never do any of these exercises without approval of your physician. All right, so let's get started. Bring the legs around, come down onto your back. Have your feet hip distance apart, and I want you to keep the heels as close to the buttocks as possible. Feet should be neutral. Don't turn them out or in. Keep them neutral, straight, and have your palms on the side. So the easiest exercise to strengthen the glutes and the hip flexors are bridges coming up. So you're going to take a deep inhale to prepare. Exhale, lift those hips up and squeeze the glutes. I want you to come to neutral, but never hyperextend. So in yoga, we tend to place the hands behind the back. You really don't want to do that after a hip replacement, and slowly come down. Now, when you come up, imagine that your spine rolls up like a string of pearls, one pearl at a time. So slowly inhale to prepare. Exhale, lift the pelvis up and slowly lift one vertebra at a time, and then slowly come down. Good. Now what you can do is add an element of strength to this. Take the ball, any size ball, place it between the knees, and you're going to squeeze the ball on the way up. So you're going to inhale to prepare. Exhale, slowly lift up and squeeze the ball. Squeeze, 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 and release. Come down one vertebra at a time until that pelvis comes down. All right, so another visual cue other than the string of pearls is to remember that you have a tray of marbles across the pelvis here. And slowly the tray of marbles, as you lift up, rolls up all the way to the abdomen, and then rolls back down one vertebra at a time. All right, so let's repeat that 2 more times. Inhale to prep. Exhale, lift, squeeze the glutes, come to neutral, squeeze the ball, and slowly come down. And one more time. Inhale to prep. Exhale, curl up one vertebra at a time, squeeze the ball, and relax. Now I'm going to do another variation where you implement arm work, and this is a true shoulder bridge because you're really working off of your scapula and shoulders. Try not to bring the shoulders to the ears. Keep the shoulders down and away from the ears. Here we go. So you're going to inhale, lift up, arms up over the head. Exhale, release down. Good. Inhale to prep. reach up. Exhale, come down. One more time, inhale to prep. Slowly come up, squeeze that ball. Exhale, bring it down. Good. And you can also alternate. So one last variation. You can inhale to come up, one hand up. Exhale, switch. Inhale to prep. Switch arms. Exhale, come down. Inhale to prep. Switch arms. Exhale, come down. Inhale to prep. Squeeze that ball. Exhale, come down. Good. And then, when you get better at doing these exercises and you get stronger, usually between 6 and 10 weeks, you could do single leg bridge. So this one, you could put your foot here and cross over. Be careful with that, especially if you have limited range of motion. Or keep it at a tabletop position that we learn in Pilates. So that's 90 degrees with the knee. That's the position I'm going to show you. Proper alignment is safer for a hip replacement. Place the hand on the floor. This is my weak side. This is it's 7 weeks out now for this hip. So you're going to see the difference between one side and the other. So you're going to inhale to prepare. Slowly come up. Exhale, come down. Inhale to prepare. Exhale. Inhale to prepare. All right, now let me show you the other side. So you're going to bring this leg up, inhale to prep. Exhale, bring it up to 90 degrees, tabletop. All right, remember this standing right heel close to the hip, and keep it nice and flat and foot neutral, not turned out or in. Keep it nice and close to that right gluteal muscle. You can point or flex the toe, whatever feels comfortable for you today. Inhale to prep. Exhale, lift up. And you can see this fires the quad, the glutes, and the hamstrings. And slowly come down. Inhale to prep. Exhale. Inhale to prep. One more time, inhale to prep. And release. Usually at the end, I tuck the knees in, rock it out. You could do happy baby if you're ready for it. You may not be ready. You might not have the hip flexion after surgery. So just keep the hands on the knees and rock it out. Always remember, you can also massage your spine, rock and roll, come back up. One more thing to remind you of is breathing. So when you breathe, make sure that you can do either the Pilates method or the yoga method. The yoga method is inhale through the nose, out through the nose the whole time. Inhale, expand, exhale, contract. Pilates is when I'm contracting and I'm lifting the hips up in that shoulder bridge. That's when I exhale through the mouth. I inhale to prep before I come up and exhale out through the mouth. In through the nose to prep, exhale out through the mouth. So those are just some pointers. And I think this is a great exercise overall for anybody that has a hip replacement and it's healed or healing, and of course with approval of your doctor. All right, till next time, bye.